Welcome to the new St. Francis school year. I'm Dan Hardwick, the Director of Athletics. Before registering for an athletic season, there are a few very important points that we would like to cover to help make yours and your student athletes' experience the best that we can. Our goal in the athletic department is to do everything we can to give your student athlete a great experience and to focus on big picture constructs rather than wins and losses. The only true responsibility a high school coach has is to develop good human beings. By instilling a set of life skills, a strong work ethic, leadership development skills, sportsmanship, a team concept, ethic and moral decision-making, a performance orientation, and infusing our mission into our programs, we have consistently shown that we will also be more successful as well. These constructs are the things that I get involved in when there are problems in my department. Things that coaches do not discuss with anyone other than the student athlete and that I do not get involved in are playing time, positions, team roles, team dynamics, and coaching strategies. We hire the best coaches we can here, and we need to allow them to make these decisions and to support them. After all, they are the experts in their field. If any concerns arise between your daughter or son and the coach, it is important to follow a communication protocol. Your son-daughter should approach the coach first after 24 hours following a contest to discuss the concern. If this does not resolve the concern, then you, the parent, should set up an appointment with the coach, again after 24 hours following a contest, to discuss the concern with the student athlete present at this meeting. If this still does not resolve the concern, make an appointment with the Director of Athletics to meet with all constituents present, the parents, coach, and student athlete. Sportsmanship. It is the expectation of St. Francis High School that all constituents, student athletes, coaches, parents, administrators, and spectators, conduct themselves with class at all times. Far too often, we are hearing negative comments directed at officials, coaches, and even the student athletes. We are currently facing a coaching shortage and an official shortage across the country. One reason is the abuse these entities have to endure during the course of a game and or a season. This behavior simply will not be tolerated. If anyone engages in this type of behavior, they will be asked to leave the premises. If you are asked to do this, the expectation is for you to comply immediately, or you may face other school-related consequences. Please do not become an embarrassment for your student athlete or for St. Francis High School. Please refer to the Student Parent Handbook for a complete description of the co-curricular participation contract that you and your student athlete are agreeing to, which includes the abstinence of drugs, performance-enhancing substances, alcohol, any tobacco products including vapes, and any other behavior that is in conflict with the St. Francis High School mission. The first violation of the co-curricular participation contract is divided into in-season and out-of-season suspensions. For in-season student athletes, suspension begins immediately and will consist of 3 weeks of social probation. This means that the student athlete may practice, but may not dress or compete in contests or events. For out-of-season student athletes, you will be suspended for 20% of the scheduled contests or events at the start of your next season. You should take a look in the Parent Student Handbook for explanations of non-athletic social probation ramifications and for the actual number of contests or events you would miss that constitutes 20% of your season. Upon a second violation, the student athlete will be removed immediately from participation in any co-curricular activity for 4 months from the date of the second violation and will not be eligible for any awards. Third violation, the student athletes will be removed immediately from all co-curricular activities for the remainder of the student's high school career. As per IHSA rules, a student must be passing 25 credit hours, failing no more than 2 classes, if they are enrolled in 7 classes, and 30 credit hours if they are enrolled in 8 classes. Measurements are based on a cumulative basis from the beginning of a semester through the date on which the check is made. The first week of ineligibility, the student will not be allowed to dress or participate in any athletic contest or event. The student will be allowed to participate in practice. Should a student remain ineligible for a second consecutive week, the student will not be allowed to dress or participate in an athletic contest, event, or practice. The coach or athletic director will contact the parents and make them aware of the situation and inform them of the consequences if a student is ineligible for a third consecutive week. Should a student remain ineligible for a third consecutive week, the student will not be allowed to dress or participate in an athletic contest, event, or practice. A meeting will then be scheduled with the athlete, activities director, the coach or moderator, the parents and students to discuss the student athlete's continuation in the sports or activity. Attendance policy. Students are expected to attend all classes on the school days in which they participate in co-curricular activities, games, events, as well as practices. Exceptions do come up when students have doctor's appointments, etc. In order for students to be eligible for games or practices, they must arrive at the school office by 8:20 a.m., and they may not miss more than 2 class periods during the day without prior arrangements made with the Dean of Students and a written doctor's note upon arrival after the appointment.
Welcome to St. Francis Athletic Training. This is Sarah Anderson.
And I'm Teope Wetterman. The purpose of this video is to give you a little bit of information on who we are and what we do at St. Francis. So we are an allied healthcare profession working under the direction or in collaboration with a physician. So we do a bunch of things here at St. Francis. So we do some primary care, injury and illness prevention, wellness promotion and education, emergency care, examination and clinical diagnosis of injuries and medical conditions, therapeutic intervention, and rehabilitation. We are often confused with personal trainers, but there is a very large difference in our education and skill set and job duties and the types of patients that we work with versus a personal trainer. We are licensed in the state of Illinois and are required to hold a board of certification credential of athletic trainer certified.
Our office is in the wellness office, which is located off the Slant Dome Gym. We are here after school from 2:30 to the end of games, and on weekends just varied on practices and games. Here is our contact information. Please take a look at it if you need it. Here is our team physician that we work with through Northwestern Medicine. And our local hospital is Central DuPage Hospital, which is if your child has to be transported for emergency, this is where they would be transported.
We have several AED locations on campus. We have 3 inside and at any time 2 to 4 outside. So please be familiar with these locations as you are on campus. What to do when your athlete gets injured. So in the event of an injury at a practice or competition, the coach or athlete should contact one of us. We will then have them either come to see us or we will respond to them depending on the injury and what is going on. If this injury occurs off-site at a practice or a game, please have your athlete see us after school in our office so that we can evaluate them, or you can contact us as needed with the information that we provided for you previously. If your athlete sees a physician, they cannot return to practice or games until the athletic trainer receives a written release stating that that is safe and that they are clear to return to play. Parent notes are considered unacceptable and we will not honor them for clearance for return to play.
Each coach is provided with the Magnus Health app account. During registration, you need to update or fill in all of the Magnus information, which includes your emergency contact information, medical conditions, and allergies for each team. If your athlete has any medical conditions, please let them know, their coaches and us know. Coaches should know where medication is, including EpiPen, inhaler, insulin in event of emergency.
The last portion of this video will go over our head injury and concussion policy. For those who are unfamiliar with a concussion, here are some signs and symptoms. They can range from emotional, thinking, remembering, sleep, and physical symptoms. There may be some also that are objective that we can observe. And at the bottom, we have some danger signs. So please familiarize yourself with these in the event that your athlete does get injured. For any student athlete who exhibits signs or symptoms or behaviors consistent with a head injury, we will immediately remove them from play. They will be evaluated by us and determine whether or not they have a head injury or concussion and whether or not they may return that day to practice or games. We will contact you and give you the concussion guideline blue pamphlet and an IHSA post-concussion consent form to be signed and returned to us. We will notify the school nurse, and upon returning to school, your student athlete needs to immediately meet with the school nurse prior to the school day. Your student athlete will see us and the school nurse daily to check in and reevaluate until told otherwise. We will complete an injury report and document these daily check-ins. A return to learn must be completed prior to beginning a return to play, which I will talk about in the next couple slides. Per the state of Illinois, an athletic trainer or an MD or DO will provide a written clearance. Your athlete must complete a return to learn and a return to play protocol prior to being cleared to return to full play. Any questions on the Youth Sports Concussion Safety Act, there is a link provided here below. Here's a brief overview of that return to learn. This is fluid and it's not direct steps daily. So we will direct your student athlete through this protocol in conjunction with the school nurse and guidance. The return to play protocol is provided below. There should be at least 24 hours between each step. They will check in with us daily and we will progress them through this return to play protocol to get them cleared for their sport. A few physicians that we refer our athletes to in the event that they need further care, such as physical therapy, are provided here. We will follow your athlete, but if they persist and last longer than about 10 to 14 days with minimal improvement, we may refer them to a physician who specializes in concussion care. If your athlete sees a physician, please be sure to request a doctor's note. This is the end of the athletic training portion of the registration video.
This concludes the athletic department and administrative presentation. If you have any specific questions, please don't hesitate to contact the Director of Athletics. Please click the Parent and Student Acceptance and Electronic Signature buttons below to continue with your registration and have a great athletic season. Go Spartans!